Joining me by phone is Dr. Cheryl Whitaker of the Whitaker Kinne Group here in Chicago. Doctor, good morning.
Good morning, Ty.
How are you?
Very good, thank you.
Well, thank you for taking time out of your busy schedule. I have always had great feelings about what's being done at Rabida Children's Hospital. Tell us about your affiliation with Rabida.
Well, Rabida is in my neighborhood. I believe we share the same zip code. It's just down the street. I live in South Shore. Rabida is a wonderful hospital. It is the only hospital of its kind in Chicago. They specialize in the treatment of children, but particularly children who are living with chronic illnesses, with developmental disabilities. So maybe they were born with a condition like cystic fibrosis, for example, cerebral palsy, and also children who suffered abuse and trauma. So Rabida, prides itself on a holistic approach to taking care of the child. So not just their physical needs, but also their social, emotional needs, and also their family needs. So in many ways, it's one-stop shopping for parents who are managing children who have to live with those types of conditions, meaning they require ongoing and support and care from the medical establishment. So Rabida is a wonderful example. It's on the south side of Chicago. Also to note, Ty, is that it's the most public aid-dependent hospital in the state. So 94% of the kids are covered by Medicaid, which is a health insurance for the poor and the working poor, meaning people who meet a certain income level as designated by the federal government.
You read my mind. That was my next question. How, in your view, is Rabida dealing with these healthcare disparities, which have been so historic?
Well, a lot of the patient care that's provided by Rabida, I mentioned to you a holistic approach. Some of those services really aren't covered by Medicaid or other insurance, but Rabida tries to do the right thing. So they're heavily dependent on philanthropy, which is part of why I'm involved. They choose every year the Chicago Citizen Honor for Community Service, and my husband and I are being honored this year for their gala. And for that gala, they focus on raising money from folks who care about their mission, who want to support it. They are heavily dependent on philanthropy to help close that payment loop for those services that they provide to families.
And your husband, of course, being Dr. Eric Whitaker.
That is correct. So we both have a passion for healthcare, improving healthcare, for healthcare disparities, for populations that may not meet the concerns of the mainstream. So, we spend our whole careers thinking about some of the issues that Rabida tackles every day.
Which makes me wonder, Doctor, did you always have this passion for helping others? Did you always want to do what you're doing now?
Ty, the answer to that is absolutely yes. And I can say the same for Dr. Eric Whitaker.
Thank you for listening. I'm Ty Wansley for Chicago Insight. We'll talk again, same time next week.